Hi, in this video we'd like to talk about threatened miscarriage management. So many patients actually contact us when they are actually going through a threatened miscarriage or potential fetal demise that is about to happen. So how it goes is like, let's give you an example, is that a patient will have their first pregnancy, second pregnancy, and then during week 6 you go for your routine examination and you will find out that the baby has a healthy heartbeat. This is actually good news. However, the week after that, they will see that the heartbeat is significantly lower, weaker now. Sometimes the heartbeat is completely missing. So now at this time, as a parent should be, they will get very anxious, very worried. Are they losing this pregnancy? In our experience, most likely, if this some sort of situation like this happens, very likely, if you're not with a specialist hospital that actually knows what is causing this reaction, very difficult to actually preserve this pregnancy. And they come to us seeking a miracle treatment, whether or not we can give them a cure for this condition, whether or not they can give them some specific advice. Because usually these patients are very far away. They get in touch with us via the website, consultation, talk to us, say, can you give me any advice? What kind of pills can I give to my wife to save the baby? Can you tell me, I'll pay you money, talk to the doctor, please help us. Now when we hear such messages, we can only we can only feel how the parents are feeling. We understand that it's very difficult. Of course, we want to preserve this pregnancy, but there is no one cure for all, one miracle pill for such a situation. A fetal demise, threatened miscarriage like this, can be a number of different causes that can lead to it. It also depends on your country's hospitals, expertise, techniques, whether or not they have experience in dealing with this. Then, for example, let's say the most common form is a lack of progesterone or ovarian insufficiency. That means there's no progesterone secretion enough, causing this heartbeat to get weaker and weaker over time. If the heartbeat is getting weaker and weaker over time, if it's caught early enough, here at our hospital, and most hospitals can actually treat this, we just supplement the missing progesterone. So however much that it is required, then we supplement it. Pregnancy will stabilize very quickly. The heartbeat will rise again, and this form of preventing a threatened miscarriage is quite common. However, it's not always effective because you cannot use progesterone for all forms of threatened miscarriages because there could be other causes. So that's why there is no one cure for all, there's no miracle pill. It really depends on whether your hospital knows what they are doing and knows what is causing. So again, diagnosis is very key. Using all the techniques that they have, they need to diagnose very quickly because usually these situations are critical. You probably only have a few days or a week of a window to preserve this pregnancy. Another common form of threatened miscarriage is caused by the antibodies known as anti-embryonic antibodies. Now, this form of threatened miscarriage happens very early on, week 4, week 5, and you will notice a very weak heartbeat. Now, we cannot recommend you to go for a treatment for this immunotherapy in other hospitals because most hospitals are unaware of these anti-embryonic antibodies. They don't even have treatments for this. So far, only Antai hospital can provide this treatment, and it's very effective that within a day or two of administration, the heartbeat will stabilize. Now, we've done this many times in our hospital where patients come, they found that the baby has a very weak heartbeat. We also diagnose them with very high levels of this antibody. Once we administer our immunotherapy, stabilizes very quickly, preserve this pregnancy. So what we can help for patients that are overseas, that are very far away from us, that cannot come to us for our expertise, we can only give you advice, and it really depends on your doctors, your hospital's expertise and what they understand about preventing miscarriages. Antai Hospital has already been in this field for over 25 years. We've encountered every form of fetal demise, threatened miscarriage, chemical pregnancies, those that can be preserved and those that cannot be preserved. We can usually identify them very quickly. So for those who currently cannot come, you can only depend on your doctor's expertise. Most of them are very capable, but we can only give you advice. What we recommend is that you try your best to preserve this pregnancy. If not, then we go for the next pregnancy, preserve the next pregnancy by visiting us, and we can give you a full systemic diagnosis and treatment. And it even comes with a full refund guarantee. That's how effective and that's how assured you can be for your next pregnancy to be successful. No other hospital can give you this form of confidence, this form of guarantee that we can preserve your pregnancy to a full term until birth. So get in touch with us as soon as possible. If possible, visit us as well to receive the treatment and see for yourself that you too can have a healthy pregnancy. Leave me a comment down below, visit the website via the link above, and let's see how we can help you.